dysmenorrhea pretty commonly in patients who are younger age group patients, like every third, fourth girl complains of dysmenorrhea. But in an older group, it becomes the number of patients presenting becomes low in the older age group.
How often do general physicians encounter dysmenorrhea cases?
Dysmenorrhea pretty commonly in patients who are younger age group patients, like every third, fourth girl complains of dysmenorrhea. But in an older group, it becomes the number of patients presenting becomes low in the older age group.
Are over-the-counter painkillers safe for long-term use in managing dysmenorrhea?
That's the main treatment of it. Especially for the girl in the younger girls, because if there is no other cause for it. But in older age group, where it starts after a lot of period, like after 5 to 7 to 8 years of having menarche. So in there can be other causes which need to be looked at. But yes, the primary treatment is the non-steroidal anti-inflammatory drugs.
Is it true that certain dietary or lifestyle changes can completely cure dysmenorrhea?
The patient, if the girls, they are good physically, and if they have controlled their weight and the diet is improved with more fiber in it, if there is no underlying cause, yes, it can be improved.
How can general practitioners identify when to refer a patient to a specialist?
So if the girl is complaining of we have to first see whether it is, there are two types of it. One is the one which doesn't have a cause to it, so it's idiopathic, and that's in the younger girls. And then the other is in the older women who have had periods for a longer time, and now they have started having this dysmenorrhea, the pain while periods. And in older women who have irregular periods or dysfunction, the bleeding occurring at inappropriate times, and they're having pain during sex, or they are having pain during, or they are having fever, or other signs of infections, then that is the time when the GP should be referring the patients to the gynecologist for further evaluation.
What advice can GPS provide to patients for immediate symptom relief?
For symptom relief, so one you can use the hot compressions, so your hot bottles, and that can be used, and you can move around, and NSAIDs will help, and hydrate yourself. That can help you with it will improve or alleviate your pain immediately when it starts.